this is Dr. Do again. This video is still on alphabetic list problems on letter S. Today I'm going to talk about the stroke. Actually, it's quite common, and I had a previous video on the cerebral vascular accident. I think I talked about the briefly mentioned about the stroke. So basically, let me just bring up the emergency situation associated with this stroke. You probably know it. Time is very critical. I think it used to be 4 hours for the thrombolytic therapy for those ischemic stroke. I'm going to explain to you. So this is a very critical in terms of the time. The time you pick up the phone, call the 911 or call the stroke center, to the time you're in the door of thrombolytic therapy. 4 hours, I think, extended to 4.5 now. So that's very critical. And also if that's the case, if you have, if you yourself or your family member advanced age with past medical histories and suddenly developed, or you wake up find out either slurred speech or dropped drooling, or the eyelid cannot open, so or the limbs cannot move or lost sensation, any of those. Regardless, could be temporary, the ischemic attack, or could be the stroke. But anyway, long-term or true stroke. So regardless, call the emergency as soon as possible to arrive. The ambulance transport you to the emergency room to start the therapy to exclude hemorrhagic stroke. So this is really definitely is an emergency situation. So basically, stroke could be the ischemic or the hemorrhagic. The ischemic could be temporary as a transient ischemic attack. TIA is short form, which less than 24 hours, and with minor or even just very subtle neurological symptoms. You probably just suddenly fell asleep and lost consciousness, and then just the transient, either lost strength in your limbs or slurred speech, but usually recovered by within 24 hours. So this is called the transient ischemic attack, or the true stroke. Either talk about ischemic, which is really by the thrombi falling from somewhere. So this kind of stroke, ischemic stroke, usually occur with those who had either deep venous thrombosis or AFib. So this, because of this AFib, can really shivering this kind of thrombi near the heart or in the heart and into the blood flow and lodge somewhere in the brain. So this is the ischemic stroke. So if that's really the thrombolytic therapy referring to those kind of stroke, not the TIA, not the hemorrhagic. This is really the stroke, lungs, and find the thrombi and to use the thrombolytic therapy. Again, and for the risk factors I just mentioned, for those hemorrhagic stroke usually occur with the high blood pressure, which is not well controlled, and or any activities increase the pressure, either bearing down or you just somehow lifting up to hold your breath too long, etc. So this kind of activity, and also on top of that, may occur in young people without history of hypertension, but just the malformation of the blood vessels in the brain. Those people also can have the stroke, hemorrhagic stroke in young age, and this could occur in family, runs in the family history. So for those who had premature, probably not the right word, early age stroke, hemorrhagic stroke, so probably you need to alert your physician, tell them that you have family members had a stroke at a young age, around 40 or even younger, or younger than 50 years old or 60 years old. So this is about the hemorrhagic stroke. So in terms of the management, like I said, regardless, you do not know is hemorrhagic or ischemic. If you find any signs, lost sensation, or lost the strength of muscle strength, or cannot move up your limb, or drooling, eyelid drooping. So any of those kind of symptoms, you need to call the emergency. When you arrive, they will do the test. I think usually just the CAT scan to identify whether there's any bleeding, because the intracranial bleeding is definitely the contraindication of the thrombolytic therapy. So that's the first step, to exclude the hemorrhage and then start the thrombolytic therapy. Your physician will know it. So this is this is quite common, and it's kind of everybody really talk about the stroke. It's the panic, generates the panic, and it's really kind of scary to especially for those older people or for those who had pre-existing conditions. It is truly scary because the risk is quite high for older people, and also for those who had uncontrolled blood pressure, uncontrolled blood sugar, and obesity, and for those easily to raise blood pressure, which means hot-tempered, for example, or doing a lot of activities to bearing down to increase the pressure, increase the blood pressure, and cause the stroke. So this is about the general idea to hopefully, I think you probably know it. So talk about that risk factors, and then talk about the preventive. I think start from early. I think probably if you do not have a family history of young stroke at a young age, then for just general population, start from 50 years old. I think probably because before 50 years old, it's the climbing up for in terms of physiological function or the organ function after 50 probably going down. So that's probably the best time to follow up your physicians, doing exercise, eating healthy, to pay attention to your health. If you have family history of hypertension, diabetes, even though you're lucky you don't have it, let your physician know. So they will, and also they will educate you how to prevent diabetes, hypertension occur to you, or start some medication. Some of the medications, for example, metformin, can be used in pre-diabetic condition to help you lose weight, and also to control the blood sugar not elevated to the, even though it's not beyond diabetic, but still to maintain optimal blood sugar level. And also some of the medications like beta blocker, not can just use in hypertension. Sometimes those panic moments, or if you're really labile on your emotions, easy to get tempered, to raise up the blood pressure for that case, or get panic in the social circumstances. If that's the case, beta blocker can also help you to decrease those moments, to increase blood pressure, those moments which cause you a panic or heart rate faster, or increased blood pressure with kind of nervousness. So this beta blocker can also serve that purpose. So anyway, and also in terms of yourself, without medication, exercise regularly, lose weight, and eating healthy diet, I think that's fundamental. And some of the supplements, you can talk with your physician whether you can take them or not to help you to maintain health, to delay the process, delay the development of the hypertension or diabetes. So this is about the stroke. It's very, it's not medical for those general populations. I think you probably know it. And this is just a remind for living a healthy style of life, exercise and eating healthy, of course, and decrease stress and keep happy mood. So I'm going to stop here, and thank you for watching. I will see you next time.